Aphasia. Aphasia is when a person has difficulty with their language or speech. It's usually caused by damage to the left side of the brain, for example, after a stroke. If you are new on our channel, then please subscribe our channel. It will be support for us. Now we move towards our topic. Symptoms of aphasia. People with aphasia often have trouble with the four main ways people understand and use language. These are 1. Reading, 2. Listening, 3. Speaking, 4. Typing or writing. Speaking problems are perhaps the most obvious, and people with aphasia may make mistakes with the words they use. This could be sometimes using the wrong sounds in a word, choosing the wrong word, or putting words together incorrectly. Although aphasia affects a person's ability to communicate, it doesn't affect their intelligence. Aphasia can occur by itself or alongside other disorders, such as visual difficulties, mobility problems, limb weakness, and problems with memory or thinking skills. Types of aphasia. Aphasia is often classified as expressive or receptive, depending on whether there are difficulties with understanding or expressing language, or both. But most people with aphasia have some trouble with their speaking, and will have a mixture of problems with writing, reading and perhaps listening. Symptoms can range widely from getting a few words mixed up to having difficulty with all forms of communication. Some people are unaware that their speech makes no sense and get frustrated when others don't understand them. Read more about the different types of aphasia. Causes of aphasia. What causes aphasia? Aphasia can happen with any condition that damages the brain. It can also happen with problems that disrupt your brain's functions. Possible causes for this include 1. Alzheimer's disease, 2. Brain surgery, 3. Brain tumors, including cancer, 4. Cerebral hypoxia, brain damage from lack of oxygen, 5. Concussion and traumatic brain injury, 6. Dementia and frontotemporal dementia, 7. Epilepsy or seizures, especially if these cause permanent brain damage, 8. Migraines, this effect is temporary, 9. Radiation therapy or chemotherapy, 10. Toxins and poisons, such as carbon monoxide poisoning or heavy metal poisoning, 11. Strokes or transient ischemic attacks. Diagnosing aphasia. Diagnosing aphasia takes a combination of a physical exam, asking questions about your history, diagnostic imaging and testing, and more. In some cases, a healthcare provider will recommend running several tests to rule out other conditions or causes that might cause effects similar to those seen with aphasia. Some examples of this include 1. Sensory and nerve function tests. 1. These tests will make sure that hearing problems or nerve damage aren't the cause behind a problem that seems like aphasia. 2. Cognitive and memory tests. 2. These tests ensure the problem isn't with the person's thinking ability or memory. 3. Diagnostic and imaging tests. 3. These tests look for lesions or signs of damage to the relevant part of the brain. Treating aphasia. Speech and language therapy is the main type of treatment for people with aphasia. This aims to help restore some of your ability to communicate, as well as help you develop alternative ways of communicating, if necessary. You may receive speech and language therapy on an individual basis or in a group, depending on your needs and the service provided. An increasing number of computer-based applications are available to support people with aphasia. But it's important to start using these with the assistance of a speech and language therapist. How successful treatment is differs from person to person. Most people with aphasia make some degree of recovery, and some recover fully. If the aphasia is caused by a one-off event, like a stroke, most patients recover to some degree with therapy. There's no evidence to suggest that recovery stops at a specific time after stroke. But the chance of recovery is poorer for people with aphasia resulting from a progressive neurological condition. Some people can still respond to therapy, but there are currently no good ways of reversing the ongoing injury to the brain. When aphasia is caused by a progressive condition, treatment focuses on making the most of what people can still do and developing other ways of communicating to prepare for a time when speaking will be more difficult. Complications of aphasia. The challenges of living with aphasia can impact how a person feels and interacts with others. In some cases, it can lead to 1. Isolation, 2. Anxiety, 3. Depression. If you're concerned about someone with aphasia, encourage them to discuss any problems with their GP or a member of their care team to access the relevant support. If the person is unable to do this themselves, they may require someone to communicate on their behalf. Prevention. How can I prevent aphasia or reduce my risk of developing it? Aphasia happens unpredictably, so it's not possible to prevent it. However, you can try to prevent conditions that cause it or reduce your risk of developing those conditions. Some of the things you can do include: 1. Eat a balanced diet and maintain a healthy weight. 2. Don't ignore infections. 3. Wear safety equipment. 4. Manage your health conditions. Comment below if you know something extra because it will be very beneficial for us.